you have a life or death medical emergency, the last thing you want to worry about is the bill. Tonight, a 4-month Larry Barker investigation uncovers a little-known loophole in the healthcare system.
It is leaving patients with outrageous bills and nearly bankrupting New Mexico families. Here's Larry's report, High-Stakes Hijinks.
I was just shocked. I want them to know that this is wrong.
I think that's cold, I think it's unethical, and I think it's uncalled for.
This is exorbitant, this is highway robbery, and we have to stop it.
You buy health insurance for protection from unforeseen medical emergencies. That's the way it's supposed to work. However, a News 13 investigation has uncovered a cruel and heartless insurance practice that's leaving some New Mexico families on the brink of bankruptcy.
Melvin and Tricia Bannister know the issue firsthand. While working on a piece of machinery in Carlsbad last year, Melvin fell and fractured his hip.
It was the worst pain I've ever had in my life. Anytime they moved me, I would just start screaming and hollering because it hurt so bad.
Melvin required emergency surgery. However, the Carlsbad hospital did not have an on-call orthopedic surgeon.
The ER doctor said that he needed to be airlifted out. First of all, I said, can I take him by car? And she said no. And I said, by ambulance? And she said, no, he needs to be airlifted.
Melvin was flown by air ambulance 160 miles to a hospital in Lubbock. He underwent surgery and made a full recovery. However, the Carlsbad retiree would soon learn this ordeal was just beginning. It came in the mail, an invoice for $65,000. It was a bill for that 75-minute medical helicopter ride.
I thought it was a crazy amount. That's just ridiculously high. And I thought the insurance will pay for it.
So the Bannisters submitted the bill to Blue Cross Blue Shield for payment. However, Blue Cross rejected the claim, sticking the Bannisters with the $65,000 obligation. In an appeal, Melvin's doctors urged Blue Cross to reconsider. They said Melvin needed an air ambulance due to severe pain and emergency surgery.
But just because your doctor says you need a medical airlift doesn't mean the insurance company will pay for it. Blue Cross refused to pay the Bannisters' helicopter bill because, in the insurance company's opinion, an air ambulance was, quote, not medically necessary.
It's all right here in the fine print. Because a healthcare provider prescribes or approves a service does not make it medically necessary. Blue Cross will determine medical necessity based on its own criteria.
It just really chaps me that, with the premiums we pay, and then they come up and say, it's not medically necessary. They're not there. They're not in the emergency room. They're not the ones that see you there in pain. And then they second guess that they're basically second guessing the doctors that are on duty there.
Should Mr. Bannister reasonably expect the insurance company to pick up the tab for that air ambulance?
Absolutely.
Chris Kraling is a former New Mexico insurance superintendent.
The one and only person in the whole world that has the authority to determine what is medically necessary in an emergency room situation is the attending physician. The insurance company doesn't have any authority to override the decision of the attending physician.
It is not right. It's not correct. It's not fair.
John Franchini is the current insurance superintendent.
My message to the insurance companies is quit deciding what is medically necessary. Let the doctors and the hospital decide what is medically necessary.
Melvin Bannister is not the only victim.
Oh, it's devastating. I mean, you end up losing sleep at night because you're wondering, how in the heck am I going to be able to pay this bill?
Travis Ludwig is a southeast New Mexico farmer raising cotton and pecans. Last summer, while burning weeds, Travis suffered first and second degree burns over 7% of his body.
I was in a lot of pain, so we went to the closest hospital here, which is actually here on the west side of El Paso. The surgeon at that time stated that I needed to go to a burn unit.
The nearest burn unit, 300 miles.
They put me on a plane and transported me via the airplane to Lubbock, Texas.
An air ambulance?
Yes. I was thinking, yeah, this is probably going to be a very expensive situation, but I didn't think I had any sort of worry given the fact that I had insurance.
Little did he know that 1 year later, his insurance company, Molina Healthcare, would flat out refuse to pay the air ambulance bill, leaving Travis Ludwig with a $65,000 debt.
I was flabbergasted. I just was completely floored.
On appeal, Molina Healthcare agreed to pay a small portion of the bill, sticking Travis with the rest, $55,000.
They're so exorbitant, it's so unreasonable and unconscionable. I mean, how can anybody afford to pay that? Nobody.
What's going on here? Well, if you thought health insurance would cover big ticket expenses like an air ambulance, think again. In New Mexico, if you have a medical emergency and need to be evacuated by an air transport, you could be stuck with a bill, and it could cost you as much as $60,000, $70,000.
It's a huge issue in the state of New Mexico. It's at a crisis level.
Insurance czar FRANCHINI calls air ambulance billing practices outrageous.
The bills are not justified. They're highway robbery. They're charging excessive amounts of money.
But one of the largest air ambulance companies in the country says they are not gouging consumers. Doug Flanders says it costs Air Methods millions of dollars to run 365-day, 24/7 operations staffed by teams of medical and flight professionals throughout New Mexico.
We're basically a flying ICU. So we can do things that you can't do by ground, and we can get there quicker, thus making sure that these patients have a greater degree of success from a healthcare recovery.
Flanders says Air Methods loses money on 80% of its New Mexico transports, which are primarily Medicaid, Medicare, or uninsured patients. In order to stay in business, he says, unpaid costs are shifted to private insurance companies. That means Melvin Bannister's air ambulance did not actually cost $65,000. His bill was inflated to make up for transports that aren't paid. When his insurance company refused to pay, then Melvin had to pick up the tab.
When we pick them up, we're hoping that the insurance is going to be able to cover their medical emergencies. If you're looking at why do you have insurance, it's for medical emergencies. We've seen an increase of 336% over the last 4 years, where the insurance company will receive the claim and then say, this was not medically necessary. The doctor who deemed this medically necessary was incorrect, and they will deny the claim. What that means to the patient is then they are now stuck in the middle because the insurance company has said, sorry, but the care you received is not medically necessary. So therefore you now have to pick up the bill.
However, you can fight back. Melvin Bannister and Travis Ludwig challenged their air ambulance bills and got the charges reversed.
A lot of the people just give up and pay it, and I made up my mind that I wasn't going to just give up and pay it. I was going to fight them to the bitter end.
Which was worse, the accident or the bill?
I would say they were pretty neck and neck, because I mean, it only took me a month to get over the physical pain, but the mental anguish created many a sleepless night.
Larry Barker, KRQE News 13.
If you have a dispute with your insurance company over an unpaid bill, you can file a complaint with the New Mexico Insurance Superintendent. For contact information, go to alwaysonkRQE.com.